A spoonful of extra virgin olive oil can be part of a healthy diet, but does swallowing it right before bed unlock special benefits for your sleep, brain, joints, blood sugar, and muscles? That is where the evidence becomes much less impressive than the internet claims. Today, you will learn what olive oil can realistically do, why bedtime probably is not a special biological window, and when this popular habit could cause more trouble than benefit. Most importantly, I'll show you a more evidence-based way to use olive oil. Welcome to Dr. Maxwell Orvane, where we make health information clear, practical, and medically responsible. Extra virgin olive oil is not merely empty fat. It is rich in monounsaturated fatty acids, particularly oleic acid. It can also contain plant compounds called polyphenols. The quantity of these compounds varies with the olives, processing, storage conditions, and age of the oil. Research supports including olive oil in a balanced dietary pattern, particularly when it replaces foods rich in saturated fat, such as butter, shortening, or fatty processed meats. That replacement is important. Adding olive oil on top of an already calorie-heavy diet is not the same as using it instead of a less favorable fat. 1 tablespoon contains roughly 120 calories. Those calories can accumulate if you begin taking a nightly spoonful without changing anything else. So what happens after you swallow olive oil before bed? Your digestive system handles it as dietary fat. It enters the small intestine, stimulates normal digestive processes, and is eventually absorbed and transported through the body. It does not wait until midnight to activate a special repair switch. Your body certainly performs important functions while you sleep, but no good clinical evidence shows that a spoonful of olive oil immediately before bed directs those processes or creates a unique overnight healing effect. Let's begin with sleep. A small amount of research has explored olive oil and sleep-related outcomes, and some findings are interesting. However, this does not establish that drinking plain olive oil 30 minutes before bed treats insomnia or reliably increases deep sleep. Sleep is influenced by many factors, including light exposure, caffeine, alcohol, stress, pain, breathing disorders, medications, activity, and sleep schedule. Replacing an unhealthy dietary pattern with a Mediterranean-style pattern may support overall health, which could indirectly benefit sleep. That is very different from calling olive oil a nighttime sleep treatment. For someone with acid reflux, taking oil immediately before lying down may actually be counterproductive. High-fat foods can worsen symptoms in some people, and health guidance commonly recommends finishing meals approximately 3 hours before bed when nighttime reflux is a problem. Now consider heart health. This is where olive oil has stronger evidence, but context still matters. Diets that use unsaturated fats, including olive oil, in place of saturated fats, can help improve cardiovascular risk factors. Mediterranean-style eating patterns that include olive oil have also been associated with better cardiovascular outcomes. But the benefit is connected to the long-term dietary pattern and what the oil replaces. Research has not established that taking it at bedtime protects the arteries during a special overnight window. Instead of drinking a tablespoon after dinner, use an appropriate amount in a meal. Drizzle it over vegetables, combine it with beans, use it in a salad dressing, or replace butter with it when suitable. That provides the oil alongside fiber, protein, and other nutritious foods. What about blood sugar? Adding fat to a meal can slow digestion and change the glucose response to that particular meal. Some clinical research suggests that extra virgin olive oil may reduce the early blood sugar rise after certain high-carbohydrate meals. Other research has examined its possible effects on insulin sensitivity. These findings do not mean olive oil prevents the dawn phenomenon, treats diabetes, or keeps glucose stable throughout the night. Swallowing it alone before bed is not a substitute for an individualized eating plan, activity, glucose monitoring, or prescribed medication. If you use insulin or medicines that can cause low blood sugar, do not invent a bedtime protocol based on an online video. The timing of food and medication needs to fit your treatment plan. Next is inflammation and joint health. Olive oil polyphenols have biological properties that researchers continue to study. Trials and reviews suggest regular olive oil consumption may favorably affect some inflammatory markers, but a food is not equivalent to an anti-inflammatory drug, and swallowing olive oil at night has not been proven to rebuild cartilage or reverse arthritis. Joint pain can result from osteoarthritis, inflammatory arthritis, injury, infection, and other conditions. Persistent swelling, redness, warmth, severe pain, or loss of function deserves medical assessment rather than a home remedy. The same distinction applies to muscle. Healthy dietary fat can contribute to a balanced diet, but olive oil is not a meaningful source of protein. It cannot rebuild aging muscle by itself. Preserving strength depends much more directly on resistance exercise, adequate protein, sufficient total nutrition, and treatment of medical problems that contribute to weakness. If getting out of a chair, climbing stairs, or carrying groceries has become noticeably harder, do not assume you simply need olive oil. Sudden weakness, one-sided weakness, facial drooping, chest discomfort, severe shortness of breath, or difficulty speaking requires urgent medical help. Gradually worsening weakness should also be discussed with a healthcare professional. Claims about the brain need similar caution. Mediterranean dietary patterns, including those supplemented with olive oil, have been studied in relation to cognitive function. Some trials and reviews report encouraging findings. However, these studies do not prove that bedtime olive oil cleans the brain, removes amyloid plaques, or prevents dementia. The brain's waste clearance systems are an active area of research. Quality sleep appears important, but no established human treatment uses a spoonful of olive oil to switch on brain cleansing. So, should you ever take olive oil before bed? For most adults, a small culinary amount is unlikely to be harmful, but there is generally no need to drink it straight or schedule it immediately before sleep. It may cause nausea, diarrhea, abdominal discomfort, or reflux in some people. It also adds concentrated calories. People with persistent digestive symptoms, gastroparesis, gallbladder or pancreatic disease, medically prescribed fat restrictions, or difficulty swallowing should seek individualized guidance. Anyone managing diabetes, kidney disease, heart disease, or major dietary changes should consider advice from their clinician or registered dietitian. Choosing a good oil is simpler than marketing makes it sound. Look for a clearly labeled extra virgin olive oil in a dark or opaque container. Check the best by date, store it away from heat and light, and close the bottle after use. A peppery sensation can reflect certain polyphenols, but its absence does not prove an oil has no nutritional value. Here is the practical action plan. First, decide what olive oil will replace. Use it instead of butter or another saturated fat when appropriate, rather than adding unlimited calories. Second, include it with meals. Combine it with vegetables, beans, whole grains, fish, or other minimally processed foods. Third, keep the portion consistent with your calorie needs. More is not automatically better. Fourth, if nighttime reflux is an issue, avoid taking oil or eating a heavy meal close to bedtime. And finally, protect sleep with habits that have stronger support. Maintain a regular schedule. Reduce late caffeine and alcohol. Keep your room dark and comfortable. Remain physically active, and seek evaluation for persistent insomnia, loud snoring, or breathing pauses. The conclusion is straightforward. Extra virgin olive oil can be a valuable part of a healthy eating pattern. Its best supported benefits come from regular dietary use, especially when it replaces saturated fat. There is not convincing evidence that drinking it before bed creates special overnight repair, muscle growth, brain cleansing, or disease prevention. Use olive oil as food, not as a miracle treatment. What have you heard about taking olive oil at night? Share your experience or question in the comments. If this balanced explanation helped you, please like the video, subscribe to Dr. Maxwell Orvane, and share it with someone who is considering this habit. This video provides general education and is not a diagnosis or personalized medical advice. Speak with a qualified healthcare professional about symptoms, medications, and dietary changes that may affect your health. Take care of yourself, and remember that sustainable habits usually matter more than perfect timing.